Now, it's 10 years since the government gave the go-ahead to a cull of badgers to try and control the spread of tuberculosis in cattle. What began in a small corner of Gloucestershire has now spread to much of England. More than 210,000 badgers have been killed in the last decade, as well as in excess of 330,000 cattle. The debate over the cull itself remains highly charged. Our environment correspondent Gregory-Kumar has been looking back over the last decade, asking did the cull work and what happens next?
This is ground zero in Gloucestershire. It was here 10 years ago that the first badger cull began, and farmers say it offered a way out of an increasingly desperate situation.
We were 11 years we were down with TB continuously, and in that period we had to pull out and shoot 400 animals.
Cattle spread TB and so do badgers. Cull supporters say killing both animals is the only way to control the disease. So 10 years on, where are we? This year, the number of cattle testing positive for TB and being sent for slaughter is down 24% compared to last year. 20,228 cattle killed. That's the lowest annual total since 2008. What started in Gloucestershire spread right across the Midlands. There are now more than 70 cull zones, including here in Staffordshire. But these cages aren't to trap and kill badgers to control TB. They're being used to trap and vaccinate them instead.
Our volunteers help us place the traps, and then we have trained members of staff who actually do the vaccination work. We've shown that it can be done sustainably and minimal cost, and we're ready to ramp up our work.
And now vaccination of badgers is official government policy, and Gloucestershire will be the first to move entirely to vaccination to control the disease. But will it work?
My concern is that having stopped culling, what's likely to happen is the badger population is likely to increase, and as the population increases, then unfortunately the risk of disease will increase.
So one of the interesting things we know about the end of badger culls from earlier work back in the 90s is that the effect tends to persist for about 4 years, and the government is funding vaccination here in Gloucestershire for about 4 years. So it's going to be quite hard to untangle what's having the impact. Is it the lingering effects of the cull having an effect on TB or the new vaccination programme? It's going to be hard to tell, at least initially. But farmers here really hope the switch to vaccination works. More of them have signed up to vaccinate than were ever part of the cull itself. But it might be another 10 years before we can see the true impact of the government's latest idea to tackle bovine TB.
And David is with me now. So, David, can we say the cull has worked?
There are lots of ways you can look at the impact of the cull on the health of cattle. We talked about the number of cattle being killed, down a quarter in my report, but you can also look at graphs like this. Now, this is data from DEFRA, and it shows the number of herds that have had a TB outbreak. So they've lost their TB-free status. Starts in 96, climbs up really sharply, and then starts to plateau, funnily enough, about the time the cull starts. And then in recent years, it's been coming down quite a lot. And I think farmers would say that's really good news. Scientists would say the problem is, if you want to say it's the cull doing that, you need an area where you're culling and you need a similar area where you're not culling. And we don't have any areas we're not culling anymore because there are more than 70 cull zones. So saying scientifically the cull is driving this is very difficult, but farmers are very pleased with this graph.
And now we move to vaccination.
Yes, and once again, it's a bit of a difficult move. Lots of people have opinions about it. I think one of the interesting things is, if you talk to Staffordshire Wildlife Trust, they are vaccinating alongside a cull. Lots of other volunteer groups are doing something similar across the Midlands. And they'd say, look, if this is important, the government should be funding us like they are in Gloucestershire. The government's paying for 4 years of vaccination in Gloucestershire. And the problem is, say Staffordshire Wildlife Trust, if you don't fund us properly, we're just relying on what people give us. And that means sometimes we don't vaccinate as many badgers as we'd like to. I should tell you, we put all this to the government. They released a statement to us tonight, and this is what they said in response. We have always been clear that we do not want to continue the current badger cull longer than necessary. Our bovine TB eradication strategy has led to a significant reduction in this disease. We are now able to move on to the next phase, including wider badger vaccination alongside improved cattle testing and towards deployment of a cattle vaccine, so jabbing the cattle themselves. That would be a big breakthrough, but it's been promised for years and it's never materialised.
When are we likely to know if vaccinations worked?
I think we'll know it's going wrong fairly quickly, and we'll have to keep watching Gloucestershire to see that. But knowing it's worked, it's really hard to untangle. It could be another 10 years.
Another 10 years.
Yeah.
Well, I'll see you then, probably before. David, thank you.